Ian. My name's Mackenzie. I'm a clinical nurse specialist. I'll be doing an assessment of your head, your heart, and your lungs today. Do you have any concerns you'd like to share with me?
Nope.
Very good. Before we get started, I'm going to wash my hands. Okay, so as we go through this, like I said, we'll be assessing your head, your heart, and your lungs today, and I'll be assessing the skin in those areas as well. And you said you have no concerns. Today you come in and you look like a 33-year-old healthy male, no trouble breathing, no cyanosis, well-nourished, no concerns thus far. So I'll start by assessing your head. Any injuries in the last few months for you or concerns in that region?
Nope.
Very good. I'm going to assess your head now, feeling for any lumps, bumps, bruises, assessing your scalp for any dandruff, lacerations. Ian's head is normocephalic, atraumatic, hair distribution is equal throughout, average texture, no dandruff or lesions or abrasions on the head. Very good. Now, Ian, what I'm going to do is assess your hearing. I'm going to step behind you and do a whisper test. I'm going to whisper a series of numbers and letters while you cover one ear. I'll have you repeat those back to me, and then we'll do it on the opposite side, okay? All right, Ian, please cover your right ear for me. 5B3.
5B3.
Very good. Now, please cover your left ear.
4F5.
Very good. Alrighty. Hearing is intact. Next, what we'll do, Ian, is assess your vision. Any vision changes for you?
Nope.
Very good. So first, what I'm going to do is turn off the lights for a brief moment to assess your pupils. I'd like you to continue looking straight ahead, and I'm going to shine a light in either side of your eyes. Look straight ahead, please. Good. Good. Lights on. All right, pupils are equal, round, reactive to light and accommodation. Pupil size constricting from 6 millimeters down to 4 millimeters. Now, Ian, what I'm going to do is test your extraocular movements, and I'd like you to look straight ahead again at my pen. And I'd like you to follow this pen with your eyes only, not moving your head or neck. Are you ready?
Mm-hmm.
Very good. Any pain or discomfort?
Mm-hmm.
Okay, continue looking straight ahead and follow my pen. Good. Cranial nerves are intact. Now I'll have you open your mouth for me. Oral mucosa is pink. Dentition looks good. Please stick your tongue out and say ah. Very good. Uvula is midline, tongue is midline, tonsils present bilaterally without swelling. All right, Ian, now next what I'd like to do is feel and palpate your lymph nodes. And I'm going to go around your head and neck just feeling for any swelling. All right. I am feeling the preauricular lymph nodes, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, deep cervical, supraclavicular. No lymph nodes palpated on exam, no swelling noted. Next, what I'm going to do is evaluate your thyroid. So I'd first like to begin by having you take a sip of water. Very good. Trachea appears midline. Now I'm going to put my hands on your neck, and I'm going to direct you on when to take a sip of water, okay? All right. Whenever you're ready, please take a sip of water and swallow. Very good. And whenever you're ready, do that again. Good. Thyroid is not palpable. No additional lesions concerned. Great. Now I'm going to listen for I'm going to feel for your carotid arteries. I'm just gonna put my hand on either side of your neck, just one at a time, okay? Great, now I'm going to listen. Okay, just one at a time. Excellent. Carotid arteries, pulse is brisk, no thrill felt, and no bruise heard. Ian, are you able to put your head to each shoulder and then look up and down and all around?
Mm-hmm.
Great. Any pain or discomfort with that? All right, range of motion good. No pain, swelling noted. Again, no lesions, bumps, bruises noted on the head and neck area. Now I'm going to take a listen to your lungs and your heart, and then we'll move on to lying on the bed for a short part of our exam. Now, Ian, as I go through listening to your lung sounds, I'd like you to just take a breath every time I move my stethoscope, okay? Great, you can breathe normally, and what I'm gonna have you do is say E for me.
E.
Very good. All right, negative for agaphnea in the left lower lobe. I'm gonna listen to the front of your lungs, and I'd like you to turn your head and face to the left. Okay. Breathe again as I move my stethoscope, please. Good. I'm going to listen to either side. I'll have you lift your right arm for me, please, and take a breath in. One more. Good. And the same on the left. One more. Very good. Thank you. Now listen to your heart now. Good. Great. I'm going to switch to the bell. Great. Breath sounds are clear and equal bilaterally. Negative egophony in the left lower lobe. S1 and S2 heard with no with no additional heart sounds. Ian, I'm going to take another listen to your heart, and this time I'd like you to lean forward for me. Great. And I'd like you to blow all of your air out and hold it out whenever you're ready. Great, you can breathe. No murmurs or aortic regurgitation heard. Now, Ian, for the next couple of assessments, I'm going to have you lying on our bed here. And you can lie on your left side, please. Great. I'm going to take another listen to your heart to hear for mitral stenosis. No mitral stenosis heard. Now, Ian, I'd like to have you lay on your back. And then I'm going to have you sit at a 30-degree position, supporting yourself with your elbows. Thank you. Lift your chin up for me. Great. I'm checking for jugular venous distension. And I am not seeing any on either side. All right, Ian, we're all done with our exam. Thank you.
Thank you.